Coming up on Kizmet.
And that's something that you want to avoid. If you aren't using those muscles correctly, then they're much more likely to atrophy.
Welcome to the Kizmet Podcast, where we explore your world of post-divorce reinvention, connection, and your pursuit of passion. Join us as we navigate love's second act.
Wow.
Welcome back to the Kizmet Podcast. I'm Kiz, and we're exploring the journey of individuals navigating the aftermath of long-term relationship breakdown. Today we have a special guest, Katy, thanks for being here, who brings a unique perspective to our conversation. Growing up, Katy's parents went through a divorce, shaping her understanding of the challenges it presents. Now all grown up, Katy is a dedicated professional with expertise as a personal trainer and specialist physiotherapist. Not to mention Katy is smoking hot with a rockin' body and finding love herself. Welcome, Katy, and thanks so much for being here. Let's jump right in and explore your experiences in helping individuals during some significant life transitions and how your personal journey informs your approach. So tell us a little bit about growing up and your parents' breakup and how that affected you.
Well, firstly, thanks for having me. Yeah, very excited to be here and be a part of it. So I grew up in Byron Bay. I had a pretty stock standard upbringing. My parents did divorce when I was 17. I would say it was fairly peaceful. It was mostly amicable. There was not a lot of fighting, but they just went their separate ways. But the way that it affected me was, now in hindsight, I can see how them splitting was actually a good thing. And they've both gone on to have very happy second marriages, which I feel like their new partners are not necessarily more suited to them, but more suited to them now in the second stage of life. And when they remarried, it brought a freshness to both of their lives. And that was really nice to see. And I was just happy for them, actually. Yeah.
That's amazing. So your parents are married for a significant amount of time?
Yeah, like it was 20 years or something, yeah.
And you were a teenager, and this outlook that you have now is awesome. And I love that, you've integrated into a positive thing for all of your family. How was it at the time? Do you remember?
Yeah, it was a little bit rocky at the time. I do recall I was doing the HSC and there were a few little hiccups, but my parents are both kind of peaceful people who didn't want to have a lot of conflict. So I think they mainly hid it from me, but also they weren't really conflicting with each other. It was more just that I think the romance had broken down and there was a need to kind of move on and seek happiness and romance somewhere else. And I get that. And I think I was old enough to be able to empathize with that. At the time it was a bit of a shock. I didn't really see it coming.
Yeah.
But within a couple of years, I'd say I'd seen both of their perspectives and was able to, move on from that.
So good to hear. And so when you left school, did you become a personal trainer then?
Yeah, I started personal training. I did a communications degree, but my passion was always in fitness at that time. So I continued. I basically worked as a personal trainer even after I graduated, and then decided to do physiotherapy as a master's, as a postgrad, because I just wanted to keep working in that space of helping people to feel good and working with the human body. And so, I did a master's in physiotherapy, and now I'm a pelvic physio, sometimes called a women's health physio. So I specialize in the women's pelvis, and inevitably a lot of that is pre and postnatal. Probably 80% of the clientele are pre and postnatal, but there's the other percent would be menopause, postmenopause, and the issues that come with that, as well as unrelated to the pre or postnatal phase. There's a group of women who might have conditions like overactive bladder or stress urinary incontinence, which is like leakage, or pain with intercourse, or kind of general sexual dysfunction. So that would be the other thing that we commonly treat as pelvic physios. Yeah.
It's all super interesting. I want to dive into some of those. But explain to me first about the pelvic floor. What do we need to know? What should women know about their pelvic floor in general?
I think fortunately people are starting to learn a little bit more. Even my profession's becoming more widely known and more common. But the pelvic floor literally the pelvic floor is the floor of the pelvis, and it's a muscular structure. Well, it's a group of muscles that make up the floor, but it's also ligaments, and you can include the organs in that as well. So the pelvic floor as a structure protects and holds in place the pelvic organs. So yeah, very crucial role. Also has a role in sexual function and bladder and bowel function.
Okay, what role does it have in sexual function? And
I guess people, if you've never had an issue with sexual function, then you might not have ever thought about it. But women who do know, they know that there's an issue. So the pelvic floor allows intercourse. If the pelvic floor is, say it's overactive is one word, or increased tone or hypertonic, it means that the muscles are a little bit too developed and perhaps the woman doesn't know how to relax them. Then that will cause a problem, because you can't get a penis in when those muscles are too contracted. Sometimes you can't even get a finger or a tampon in.
Really?
Yeah, so that's a condition we usually call vaginismus, and that's one of the things that we treat. So yeah, if you can't have intercourse, for most people, not everyone, but that's going to be a problem.
Yeah, absolutely.
And the other, if it goes the other way, and this happens as you age naturally, the pelvic floor or the muscles of the pelvic floor can atrophy, which means the muscles actually become less developed and the vagina can become a little bit more lax. It doesn't always happen, but it can happen with aging, and it's due to hormonal changes, and it's also more likely to happen if a woman doesn't know how to engage those muscles, or she hasn't been using those muscles correctly, potentially her whole life. And so if the vagina is too lax, then that's going to affect sensation.
Right.
For both partners.
And so what is the treatment for somebody who has the symptoms that you're talking about, maybe a bit of a lax vagina and poor pelvic floor muscle?
Yeah, so the treatment is different depending on what the condition is, obviously. If the muscles are too contracted and too tight, then we do what's called down training. So it's a period of time where we teach the person how to relax the pelvic floor with various cues. A lot of it is psychological, so and sometimes more so than others if there's been a background of trauma or something else going on in the background that means that the woman can't relax when there's a sexual situation. So yeah, we need to. There's a period of time where we need to down train the pelvic floor,
and that would be for somebody too who had a small vagina and they were partnering with a really big penis. Is that?
Yeah, so there can be some sexual incompatibilities as well. If someone is anatomically a smaller person, then usually they have anatomically a smaller vagina. If they had that as well as a hypertonic or an overactive pelvic floor, and the situation was that you could barely get a finger in, well, then you can imagine if she was with a big partner, sometimes that's barely going to work. And even if you got the best situation possible, so even if she worked with a pelvic physio, we do internal pelvic floor release. It's much like, it's kind of like trigger point and massage for the inside of the vagina. So we do that. We do the down training, the relaxation, the breathing. If we did everything, and it might take a number of months, it could still be that it would always be a little bit difficult and perhaps a little bit uncomfortable with a bigger partner.
Right.
But it shouldn't be impossible because the vagina is really designed to stretch.
Yeah, well, babies come out. But
yeah, so.
But it might be a bit daunting to have someone really big if you're only small.
So sometimes we do have to ask, like, what is the end goal here? How big is your partner? That might be a question we have to ask. And yeah, and not forgetting that that's not always the goal. You know, not everyone needs to accommodate a penis.
But it's a try before you buy.
Yes.
Which isn't always the case with different religions.
If possible, try before you buy. Yeah.
Definitely get it. So Kegel exercises, just on this note, are something that's kind of a catch cry that we hear all the time nowadays. Are you an advocate? Can you explain what they are?
Yeah, I think a lot of the time if you ask someone on the street what a pelvic floor physio does, people think Kegels. And so that's kind of our stigma. We do a lot more than that, by the way.
Yeah.
But yeah, Kegels, I mean, Dr. Kegel, I think he got named after him. We don't call it Kegels in our practice anymore. We call it pelvic floor muscle training, which gets shortened to PFMT. It's usually, and it's not just literally squeezing. There's a variety of exercises. Sometimes it's coordination based, which is a little bit more complex. Sometimes it's strength or power. Sometimes it's endurance. And then we'll incorporate that into other exercises and functional positions. So it's not always just squeezing the pelvic floor. But yes, a Kegel refers to the contraction of the pelvic floor muscles voluntarily. So like a squeeze and a release, which is like a feeling of drawing in and up through the pelvic floor. And most people innately know how to do this, but there are a small percentage of the population that don't know. And I think there are stats on that. I don't know. I think it's like 1 in 10 kind of get confused, and some people even push down when they should be lifting up.
Okay.
So yeah, you want to know if you've got an issue with contracting those muscles, because as I said before, as you go through life, especially as you age, if you aren't using those muscles correctly, then they're much more likely to atrophy or, have decreased tone. And that's something that you want to avoid.
Okay, so talking about somebody who's older and you don't want them to atrophy, what are the things that somebody can do from early on to make sure that they keep their tone and that it's all still working?
Being in touch with your body and being alert to any symptoms as they arise. So things like leakage with urine when you cough or sneeze, that's called stress urinary incontinence. If something like that starts happening, it's worth going to your pelvic physio and getting it checked out. There are a number of reasons why that happens, by the way. It's not necessarily a weak pelvic floor. And what we know now is that largely it's not a weak pelvic floor, but it can indicate other things that might need attention. Any new symptoms that are arising within the vagina should be checked out before they spiral into a situation that's less fortunate, like a prolapse or something like that.
Oh, that sounds awful.
Yeah, so being in touch with symptoms will be one of them. Maybe doing some kind of pelvic floor muscle training, whether it's isolated Kegels or whether it's going to a Pilates class and learning how to engage those muscles correctly. Definitely going to see a pelvic physio if you have any doubts at all, because then you can get that feedback as to whether you are contracting those muscles correctly, and then you can incorporate that in your day-to-day or in your exercise that you're doing. You don't need to walk around with your pelvic floor muscle clenched all day. That would be the wrong advice.
Yeah, right.
If you do that, you'll end up with that hypertonic problem. So that's not the right advice. But yeah, having an awareness of the muscles would be the best thing.
Yeah, there's absolutely a balance there. And I think finding that balance for somebody who's older, it's not really something that's been spoken about. I mean, now it's kind of more common to hear about, and a pelvic floor specialist, physiotherapist, wasn't something certainly that was available maybe 10, 15 years ago. That's a real shift.
The older clientele that I have, the ones that come post-menopause, say they're in their 60s and 70s and beyond, that have had children, and this is the first time they're learning about their pelvic floor when they come in. So they've got some kind of an issue, some kind of a symptom, whatever it may be, and I'm educating them for the first time. And that's really different to the pre- and postnatal patients that I have who are in their 30s, and they're well learned already. They're doing reading on the internet. It's common to come to the pelvic physio just for a checkup, pre and postnatally. So luckily those women will already be in a better situation by the time they get to that postmenopausal age. And so therefore there is less likelihood that they're going to run into problems. It can still happen, but yeah, thankfully it's becoming much more widely talked about. And once you're educated on what not to do, then you can look after your pelvic health, into the future.
So tell me what not to do. What are you thinking?
So there are things that we kind of advise. I think, look, if we're talking about one of the main issues that postmenopausal women run into, it's prolapse. And that can be quite a terrifying. I know. But the thing is, there's a lot of stigma with that word prolapse, and I really like to destigmatize it a little bit, because actually 70% of women across the board will have some kind of a prolapse in their life. That's what we know now. It's really high. Most of it will be mild.
Many? What did you
70.
say?
Yeah.
Really?
Yeah. So there's a grading system. There's a stage 1, 2, 3, 4 prolapse. Your 3s and 4s often warrant surgery, because that's when one or more of the organs is actually sitting outside the entrance to the vagina. So you can imagine that's quite a
really
situation.
Uncomfortable.
But even that is not that uncommon in that older population, especially if they've had multiple vaginal deliveries. So the risk factors for developing a prolapse is vaginal births, big babies, big heads, fast stage 2 labour, so when the baby comes out really fast. Those are the kind of natal related ones, but then there's also heavy lifting, especially like occupational lifting throughout your life, genetic factors like hypermobility in the tissues, obesity is a big one. And then not having it, if you don't have an awareness of the muscles as well. So not kind of knowing how to engage not just your pelvic floor, but also your core and your abdominals when you do lift or do work or do exercise.
When I think of prolapse, I think of, as well as like, I'm thinking of a vagina kind of coming out of your body, and you're talking about organs being affected by that. But there's stages. Can you talk a little bit about that? Yeah,
I think that's why it gets such a reaction. The word prolapse itself kind of indicates something falling out or something really in the wrong place, which is what it means. But luckily there's been a lot of research on this, and in the last couple of years, the diagnostic criteria for a prolapse has actually changed. So now we'll do a clinical assessment. We'll simply look at the vagina and ask the woman to do a bear down, and we can test in standing as well and just see where the organs are. And they've actually done this huge body of research, which was that I think it's like over 50% or around 50% of women, even that hadn't had babies, would be classed as a stage 1 or stage 2 prolapse on this diagnostic criteria.
Okay.
So they've had to throw that out a little bit and say, okay, well, that's actually just now what we consider normal movement of the vaginal walls with pressure being intra-abdominal pressure, like a bear down or Valsalva, if you want to use that word. So they've realized it's actually a lot more common, a lot more normal than they thought. And now we don't diagnose it as a prolapse unless a woman also has symptoms. Because what's the point if there's no symptoms in freaking someone out and saying, oh my God, I'm seeing a stage 2 movement of the walls, therefore you have a prolapse. It's not useful information. And there's that stigma that comes with the word prolapse. So inevitably they have an anxiety meltdown, and then we have to explain, well, actually this is how common this is. This is not going to progress. Because that's the other thing, they've done research and they've realized that the progression or the rate of movement of those organs down is very, very slow.
Okay.
Extremely slow. It's not just going to suddenly fall out.
Yeah. So the prolapse 1 and 2 that you're talking about, are you talking about that happening across all ages? It can happen across any age?
Yeah. And it mostly happens after childbirth, but it can totally happen gradually without ever having a baby as well. Yeah.
And increases with age?
Menopause, when the hormones change, that's when the vaginal walls, the muscular walls of the vagina, usually decrease in their bulkiness a little bit, and the hormonal changes that come with that can lower the organs a little bit more as well. And that can just take it can take it from a stage 1 or 2 to maybe a stage 2 or 3, or it can simply just make it a bit more symptomatic. And that's when a woman might start noticing the symptoms of a prolapse.
Okay. Yeah. And the things that we can do around that to prevent it, and I think there is fear. A lot of fear, like you
there's
hear
a
the
lot
word
of fear.
prolapse.
Yeah, there's absolutely a lot of fear, and that's one of the things that that I try to do is to destigmatize it, as I said, which is let's normalize prolapse. Let's talk about how common it really is and how most of the time it's not severe. And even if it is severe, we have treatment options for that. I think there's this and it feels really unfair on women that the vagina is so targeted, like this fear around things going wrong with the vagina, or that even prolapse aside, even just the tissues like the internal and external labia becoming like changing with time, and this ridiculous notion that we have to have it all,
tucked in
and people getting the labiaplasty surgery, stuff like that.
Crazy.
Like things are going to change in the body. They always do, other parts of the body as well. And it's unfair to target the vagina as somehow, needing to be perfect, to be desirable. And most of the time, if you ask people, men, women, if you ask them sexually what they desire in a vagina, it doesn't need to be tucked up. It doesn't need to be like that at all. And that's, so it's something that somehow society has constructed, and I think we need to move away from that.
I agree totally. This idea of perfectionism according to one standard. Yeah. And I think it can happen for men and women, penis size, but I know that labioplasty has become a really popular surgery. And in fact, vaginas are so diverse, and look so different.
Yeah, if you're with someone that rejects you sexually, because you've got a flap hanging down, I mean, you're with the wrong person.
Yeah. Oh my gosh, I applaud you for saying that.
Yeah,
It's so true.
and that's
Choose
why
better.
sexual confidence is so important. If you are self-conscious about your vagina, then that's going to come across in the bedroom.
Yeah.
And that's really all that matters. If you're sexually confident in the bedroom, doesn't really matter what's going on necessarily down there. It's going to come across that you're sexually confident, and that is the turn on for people.
So true. I just really want to highlight that. It's so true. The confidence is everything, which is in a holistic way what we're talking about. You know, your appearance, the way you feel mentally, and exercise certainly contributes to all of that.
Yeah, and I was just going to say as well, we all know that relaxation is required to be turned on, like for our libido, for us to be aroused and perform in the bedroom or have a good time in the bedroom. We need to be relaxed. And so, yeah, having that sexual confidence is part of that. If you're self-conscious about the way you look, you're not going to be relaxed and you're not going to be in the mood or lubricated, you know, and then the whole thing's downhill from there. So, yeah.
So the pelvis, it's a really holistic way of looking at your body. And so keeping those things in check so that you continue to be healthy and don't have a prolapse down the track.
Yes.
Like, what are the things we should be doing?
So those are the major ones. Especially if you have had vaginal births, then you've already got one of the risk factors. So you want to avoid the other risk factors if you can. So obviously some you can avoid, some you can't. You want to have children, that's just what it is.
Yeah.
But yeah, reducing heavy lifting, and if you do have heavy lifting as part of your job, you want to learn how to recruit the core and the pelvic floor and use your breath as well effectively. Because when people don't use their breath correctly and they're maybe bracing their abdominals quite a lot, you put pressure on the pelvic floor. And if you do that a lot throughout the days and weeks and months, like in your job, then that can contribute to those organs shifting lower down in the pelvis and causing prolapse, yeah.
So with the breathing, I think that's a really interesting point. So say I was lifting something, I would breathe out as I lifted the heavy part, like explain that.
To a certain extent, if you breathe out rather than holding your breath, that's one way of looking at it. So when we hold our breath and do that and brace the abdominals, which means bulking out the superficial abs, that puts pressure on your pelvic floor. And if you do that now, you can feel it.
Right.
But if you draw in gently through your deeper core and draw in and up through your pelvic floor and exhale, you can keep the system tight.
So what are the tips then if you're lifting something to breathe out, like you said?
Yeah, contract the pelvic floor beforehand. Make sure you know how to do that correctly. Make sure you're not doing the opposite, which is, bearing down. Engage the abdominals, but again, make sure you know how to do that. So this is something that we teach a lot in Pilates. So clinical Pilates, we focus on training how to properly use the deeper layer, the transverse abdominals, to create stability for the spine instead of the superficial abdominals. Yeah. And that's kind of a simplification, but
I'm sure.
Yeah.
It sounds like it's a complicated, part of our body that we need to nurture.
But if you just lift, occasionally, it's not going to be a problem. Like if you just have to move a box or something like that, it's not going to cause irreversible damage on your pelvic floor. It's really the repetitive nature. Yeah. So occupational lifting is like as a carer or, in aged care or if you work with disabled people and you've got to literally lift and help them move. That's that kind of thing.
Yeah, that would be hard on all parts of your body.
Yeah,
like really, it'd take its toll, your back and neck and all that kind of stuff. And I know that when we're talking about Pilates and aging and people going through menopause, you have as a personal trainer, I don't know about your physiotherapy, the age range, but I know you've worked out with my daughter and teenagers and right through to elderly patients.
Yeah.
And we're really kind of focusing on here people who've maybe gone through a divorce after a long time or a relationship breakdown. And, oftentimes we see infomercials and things on TV where people at that kind of middle age are really slowing down and, the exercise on those bad kind of step things where you're sitting, terrible things that you see advertised and promoted for people who are getting older.
Yeah.
As a personal trainer, are you, do you adhere to that? You should kind of slow down or should you amp up? Like, what are your thoughts about?
Yeah, it's really interesting. I'm probably more on the don't slow down, but I'm not there yet myself, so it's very easy to
not
say.
even close.
I think naturally as we age, we do get a little bit more tired, don't we?
I don't know.
And it's you wouldn't know.
I'm in denial.
It's easy to listen to the voice in your head that wants to stay sitting on the couch when you're tired. But if you do that 5 out of 7 days, you're not going to really progress. So I think, as you age, having goals, if you want to maintain muscle mass, that's ultimately what we should be aiming to do, because as we age, our hormones change. We don't hold on to muscle mass as easily. Once our muscles atrophy, it's much harder to build that muscle back. That affects our hormone levels, and it's kind of all a cycle. And not to mention the effect on bone density. So just from an overall health perspective, like maintaining muscle mass is a really good thing to aim for. And if you want to maintain muscle mass, you're probably going to have to be exercising, doing some form of strength training about 3 days a week as a minimum. That's what I would aim for. That's what I would recommend for people in that age group. Yeah. And men and women,
So with training such a diverse group of people and also seeing them in your physiotherapy practice, have you had experience with people who are going through changes in their relationships and they are improving, they get better?
Are you asking about a kind of a link between having a new situation, like a relationship ending, and then feeling
a revenge body
motivation to...
What's your experience? Are people demotivated or are they more motivated? It's totally anecdotal, but I'm interested in your experience.
Once there's been some healing, and that the mourning or the loss or the grieving or whatever it may be is kind of over, there's a renewed curiosity in and sometimes in their own bodies, but in that sense of, where to next? What can I do now? And a lot of the time that can be a really positive thing, like wanting to reshape their body, wanting to get back into some form of fitness, but also wanting to do things that they're genuinely interested in, that make them feel good, that maybe they haven't been able to do because they've been in a relationship and they've been serving, other people's needs. So I think definitely it can be a positive thing. It can be a source of motivation and a reason to investigate your own body a little bit more, both externally and internally, and what your desires might be or what your interests are. Yeah.
So there's an internal improvement, like the, mental health. And what about the external appearance? What's your impression of people working out to look better? Maybe get back out there after one partner for a long time.
I think it can definitely be really confronting if you are single for the first time, especially at a slightly older age than what you might have been last time you were single.
Yeah.
And that's daunting for a lot of people. And I would like to think that our society supports a positive body image, but I don't know. I think it can be scary for people. I think, especially with dating apps and, it makes the whole dating scene seem really fickle and very image-based, when people are literally scrolling through pictures like yes, no on dating apps.
I know you've done a fair bit of that yourself.
Yes, I have done some dating apps.
Like we all have.
Yeah.
Like we all have, but it is image-based and it's very quantity-based. So I think I may have mentioned to you a friend of mine was on a dating app, a date, and she went to the bathroom while this date was happening and she checked her phone and the guy that she was on the date with had liked her on a different app. And it was she thought the date was going quite well. And in fact, this guy was liking her thinking she was somebody different.
Oh.
Not actually recognizing that he had liked her on a different app when he was on the date with her.
And he'd scrolled yes when he was on the date.
On the date, she was just happened to be in the bathroom. And I think that's the quantity. So
definitely
you have to go through a lot. And I think appearance, to go back to it, and people working out, I think it's definitely a factor in getting back out there. You have to feel good in yourself, right?
Yeah, you've got to feel good in yourself, and that does look different for different people. Some people really want to trim down and look really fit, but I think there's also just work to be done deeper than that, that makes you walk into a room and have confidence. It doesn't need to be that you're thin. It can be something that's shining from deeper within, and that I think that probably requires a lot of work after a divorce or something traumatic like that. It's that mental component.
Yeah.
Yeah.
And I think exercise is a part of that because it can bring some internal mental health positive changes.
Yeah. I mean, it's something weird happens when you exercise, right? Even just on the day, in the short term, it's the feeling of endorphins that actually feeds back into your level of confidence. And I think it also makes you feel proud of your choices. You know, like I'm making good lifestyle decisions. I'm here working out. You get that sweaty feeling, and then you walk away just feeling much better about yourself in general and much more like in control of your life.
Yeah, I think there's a control aspect of it. I think the breathing, I think there's just it's a holistic way of feeling better. And I think, you know, you've certainly helped me and I think I've improved. I mean, you've helped me improve over the past few years and I'm really grateful for that. I think my body's as good as, I mean, probably not as like when I was 20 and
you
age.
look amazing.
but I'm really comfortable with the way I feel. I certainly think taking my clothes off after being with somebody for more than 20 years with somebody new, if I didn't have that confidence, and that confidence is growing and growing as I become stronger, and you've certainly been a factor in that. So, yeah. Thank you so much for coming in today.
No
Love
worries,
your
my pleasure.
insights. You're such a specialist.
That was really fun. Thank you.
Thank you. On the next episode of Kizmet.
Separating can allow you to really self-reflect and look at, what do I want? Who am I? How do I want to present myself in the world? How do I want to be perceived?
Don't miss an episode. Hit subscribe where you're getting this. Follow our socials and ask any questions on my new website where we're building for like-minded people wanting to reconnect.